You're welcome to another episode of Fertility Talk with Olarunke Thaddeus. Last week, we started a series on fibroids and various options you can exploit to take care of your fibroids, to have them removed or shrinked. We've discussed about uterine fibroid embolization last week, and today we're going to talk about MYOMECTOMY. MYOMECTOMY is a fibroid operation. Yes, it's an open surgery. So let me take you through MYOMECTOMY procedure, and probably you can check for yourself if it is something you need. What is MYOMECTOMY? MYOMECTOMY is a surgical procedure to remove uterine fibroids. Fibroids, of course, they are non-cancerous growths that appears in your uterus. Uterine fibroids usually develop about childbearing age, but they occur in any age. Okay, but most of the time they occur about when you started menstruating and all through your menstrual cycle. Okay, the surgeon's goal during MYOMECTOMY is to actually take out symptoms causing fibroids and to help you to reconstruct your uterus. So, does fibroid surgery works? Okay, the truth is that also, just like uterine fibroid embolization, where all the symptoms will disappear the moment it's done, so also women who undergo MYOMECTOMY also report significant improvements in their fibroid symptoms. Symptoms such as heavy menstrual flow, heavy menstrual bleeding, pelvic pressure, all these are also reported to go with fibroid surgery. So why is it done? Most of the time when fibroid surgery is done, this is because there are symptoms troubling you, okay, and interfering with your normal activities. And that is the major reason why a woman would say, oh, I want to do a fibroid surgery. At that point, the quality of life is impaired with the presence of the surgery, and that would just be something on your mind at that point in time, just to help to improve the quality of life, reduce pain for you, reduce excessive bleeding and stuff like that. Also, childbearing is another one reason why a lot of women undergo fibroid surgery. Some fibroids, when especially because fibroids, it is believed that they affect fertility, and they have to go, they have to be removed if you want to improve your chances of getting pregnant. Another reason is also for you to keep your uterus. Fibroid surgery is done, okay? Rather than having a total womb removal, fibroid surgery can be done to preserve your fertility. Okay, there are three types of fibroid surgery. There are three types of MYOMECTOMY. There is the popular abdominal MYOMECTOMY, okay, known as laparotomy. So your surgeon will cut you, can give you a bikini cut or give you vertical incision, a vertical cut. So it's an open surgery, and a lot of women whose aim is to preserve their fertility is usually advised to do this, okay? Another type of MYOMECTOMY is laparoscopic or robotic MYOMECTOMY, okay? In this type of procedure, it is a minimal invasive procedure. Your surgeon or your doctor would access and remove the fibroid through several small abdominal incisions that will be made, okay? And women who undergo laparoscopy have less blood loss, and they stay shorter in the hospital, okay? And recovery rate also is very fast, and minimal risk, also minimal complication, even minimal adhesion after the surgery. All these are benefits of doing laparoscopic MYOMECTOMY. The third type of MYOMECTOMY is hysteroscopic MYOMECTOMY. If you are my follower, I love this procedure very much because it can do a lot of things. It can be diagnostic, it can be operative, okay? To treat similar fibroids that bulge significantly into your uterus, yes, your doctor might suggest that you use operative hysteroscopic, okay? Yes, so it becomes hysteroscopic myomectomy. So your doctor would assess the fibroids using the instrument inserted through your vagina and cervix into your uterus. Okay, so this procedure can cut out small fibroids, can cut it out, and yes, if you do this, you might prevent going through laparotomy. So let's talk about the risk of myomectomy. On the general, it has a low complication rate. That's the truth, but still, there's still some risk. Number one risk is excessive blood loss, especially when you do abdominal myomectomy, when you do the open surgery one. And most especially, one of the major reasons why myomectomy is done is because of excessive bleeding. Women that has fibroids, a lot of them they are usually anemic. So because they've actually been losing a lot of blood on a regular basis. So this also is an issue. And due to this, it can pose a higher risk during the procedure. But however, this is mitigated against by building up your blood counts before the surgery. So there's nothing to worry about. All you need to do is to get some blood before the surgery. I don't mean to scare you. I just want you to be prepared ahead for your surgery, okay? So you can actually have it smooth if you prepare adequately by getting some blood when you know you are anemic and before the surgery, okay? In fact, most of the time also blood transfusion might be done after the surgery. Another risk that myomectomy could expose you to is scar tissues. Incisions into your uterus to remove fibroids can lead to adhesion. Adhesions are bands of scar tissues that develop after surgery. Okay, like I've said earlier on, laparoscopic myomectomy may help you to have a small amount or reduce the rate at which you will have adhesion. Okay. Also, another risk of myomectomy is pregnancy or childbirth complication. A myomectomy can increase certain risk during delivery, and if you've done myomectomy before, your doctor might advise you to do a cesarean section so that to avoid complications during pregnancy, and most especially when you are exposed to labor. So to avoid a situation where your uterus would rupture, yes, a cesarean section is usually advised after you've done a myomectomy. Another risk of myomectomy is the risk of losing your womb, okay? But that's very rare, okay? That's very rare, so don't get scared. Only in few cases that would happen, and usually that happens when your doctor is not able to stop the blood flow, control the blood flow during the operation. You might just need to have an emergency hysterectomy done at that point in time. Another risk also with myomectomy is the risk of having to operate a cancerous growth, okay? God forbid if there is any cancer tumor in there and your doctor did not discover that and it was caught, it could pose other risk of the cancers spreading all over. And this has few risks that is associated with this procedure. But however, like I said earlier, fibroids are non-cancerous, but I am just talking about a situation where there is cancer in there. So let's talk about some of the things you can do to minimize some of this risk I have spoke about, and just to prepare you ahead for your surgery. Number one thing you can do is to actually take iron supplements and vitamin. Iron supplements will help you if you are anemic and if you've been having severe menstrual bleeding. So you need to be on iron supplements and vitamins, okay? Another thing you can do to help to reduce the risk of this operation is actually to have an hormonal treatment done. You could discuss this option with your doctor. With hormonal treatment, the fibroids can be reduced, shrink a bit, but try not to be on hormonal treatment for a very long time, because if you do, the fibroid might completely shrink, but the moment you cut off the drugs, then it will grow back. So if you have a very big fibroid, you can be on hormonal replacement therapy for some weeks, and your doctor would, however, help you to regulate this and tell you how long you can be on it, so that, for instance, if he doesn't want to do laparotomy for you, he might now decide to do laparoscopy for you when the fibroids are already reduced to minimal. So that's the whole essence of having an hormonal in place first before the surgery. Okay? What to expect after your myomectomy? Yes, all the symptoms will be gone. Bleeding, pains, abdominal pain, pelvic pain will be gone. Okay? That's one beautiful thing about the procedure. Okay? So also, you need to let your doctor know if you're trying to get pregnant, so that special care will be taken during the procedure to preserve and protect the cavity of your lining. You should resume activity back in about a month, and you can try to get pregnant 3 months after your fibroid surgery. Between 3 months to 6 months, try and get pregnant. If you do it 1-2 months and pregnancy is not achieved, you can consider IVF, because you wouldn't want a situation whereby the fibroid will grow again. So before that stubborn fibroid occupies your lovely uterus again, try and make your baby occupy that space. Okay, so those are just my little tips for you after your fibroid surgery. Thanks for watching today's episode of Fertility Talk with Olarunke Thaddeus. For more enquiries, kindly comment below or send us DM or call the numbers showing on your screen. Take care and God bless.